the country by the end of the Parliament.
Thank you very much. Thank you, Jeremy. As you can imagine, running Healthwatch in Staffordshire has a lot of challenges, and you mentioned mid-staffs twice. Unfortunately, Staffordshire is synonymous with bad quality, and Staffordshire only ever really gets mentioned in terms of exemplifying poor quality, which is a great shame for both the public and the staff that work within Staffordshire, and something they feel very blighted by. Another observation I would make from my work in Staffordshire is that what the public really want is one NHS. And they want one care system, actually, not just one NHS. And they believe they have one NHS until they get into a place where they're getting handoffs between one organisation and another, or where they see how the systems don't join together. And those are often the points at which we get complaints, at which people come to us with concerns, where that doesn't work out properly. And it is a fairly fragmented system. You talked about the need for integration and collaboration, and I was really heartened by what you said about looking for longer-term contracting. If I give you a little example from Staffordshire at the moment, the school nurse service in Staffordshire was lost by the Community Trust in Staffordshire to a trust in Birmingham. Birmingham school nurse service was lost by the trust in Birmingham to a trust in Shropshire. Now, that all creates a lot of TUPE, a lot of noise, a lot of uncertainty for staff. It doesn't help patient care. And so I guess my question from all of that is that within a system then and a culture, you talked about culture as well, of competition, which we have deeply embedded within the NHS as it works now, how do we foster that collaboration, that patient engagement and staff engagement, the integration and the long-term planning that you talked about to create locally sustainable care systems?
Well, I think the answer bluntly to that is there's good competition and there's bad competition. I don't think that all competition is bad. I think we need to spur innovation. And I think you see some of the most extraordinary innovations coming from private sector operators in this country and other countries, from voluntary sector, from charities. And we never want to close our eyes and ears to the potential that comes with that innovation. At the same time, we don't want competition to prevent the joining up of services that is so important for vulnerable patients with complex needs that are going to be interacting with the service on a daily basis. I think that the sort of the Milburn view of the world was coloured by the simplicity of saying that if you want a single discrete piece of elective care, a hip or a knee replaced, then it's very easy to say, well, let's have a choice of providers and go to somewhere where you can wait the shortest amount of time and that you're happiest with the quality for that. And that's fine, and I think it works well. But I think when it comes to integrated care, I think it's absolutely right that the commissioners should choose in a competitive process the best people to provide different elements of care, but then they need to join it up, so that from the patient's point of view, it is seamless and integrated and, as you say, one NHS. I pay tribute to the staff at County Hospital Stafford because I fully understand the challenges they've been through, and actually I think there's been some really important improvements in the quality of care that they've offered there. And there was one question I didn't answer that Ray posed, which was relevant to what you're saying. Who is going to be, calling the shots in terms of integrated care in different parts of the country? The insight from NHS England and the forward view, I think, is very clear on that we shouldn't dictate a model from the top, because that's really been the history of the NHS, that the Department of Health decides on a model and tries to roll it out across the world's fifth largest bureaucracy. What we need to do is to go with the grain of what's working in different areas. In some areas, the smartest people in town will be in an acute trust, and they may well be in the driving seat for the transformation of care and the forward view. In other areas, perhaps Greater Manchester, it could be the local authority. So yes, I can see parts of the country where the NHS and social care system are run by the local authority, and in parts of the country it will be groups of enterprising GPs or CCGs where the innovation is best placed to come from. And providing we have a proper system of transparency of outcomes, so we can actually see what the quality of care being delivered to patients is in different areas, I'm